Hello, I'm Jim Morningstar, Director of the Transformations Breathwork Training Program, a trainer of breathwork professionals since the 1970s, and originator of Therapeutic Breathwork. This presentation is intended to give useful information, backed by research and clinical practice, about the difference between correctly modulated, faster than normal breathing for health and healing purposes and what's commonly called the hyperventilation syndrome. Breathwork is the science and art of breath awareness and breath modulation. It's directed towards releasing dysfunctional patterns of physical, emotional, and mental functioning and fostering harmonious integration of one's network of life systems from the neurological to the spiritual, literally to feel more comfortable in one's skin. Therapeutic breathwork has brought together time-honored healing traditions with contemporary breakthroughs in mind-body therapies and incorporates both slower than normal breathing, 4 to 5 breaths a minute, and faster than normal breathing, 30 to 70 breaths a minute. The latter works with sympathetic nervous system regulation for conditions in which physical and emotional blockage causes dysfunctional holding patterns, often impervious to simple manual manipulation or verbal intervention, such as trauma. It's also proven effective in expanding conscious awareness in healthy individuals. Unfortunately, these techniques are open to be misused by untrained individuals or confused by the general public with a clinical syndrome called hyperventilation. I will present data from Gunnel Minett's excellent book, Exhale, my own clinical experience, as well as other research studies demonstrating the safe and therapeutic benefits of correctly modulated, faster than normal breathing. Now, there are a number of reasons why we restrict our breathing and start to breathe only in the upper part of the chest. The most common of these are stress and psychosomatic disorders, but it can also have to do with mechanical disorders in the respiratory system or problems in the metabolism that causes changes in the acid-base balance of the blood, which needs to be compensated by more rapid breathing. Diabetes and kidney or liver disorders are examples of this. It can also be indicative of disorders of the respiratory center, of the glands, of the heart condition, high blood pressure, and other similar disorders. But restricted breathing can also be caused by a simple problem such as tight clothing or simple vanity that makes a person walk around with their stomachs pulled in, or linked to the food we eat. Allergic reactions caused by milk, wheat, corn are some of the most common food-related causes. It has been known for some time that some foodstuffs can cause anxiety, depression, migraine, and also hyperactivity and autism in children. There has been an increase in the volume of research to study the links between breathing and the food we eat, as cited by Fried. These references are listed at the end of the video. The most common breathing disorder is probably hyperventilation. If we don't breathe deeply enough to bring in enough oxygen with every breath, we need to breathe more often to compensate. In shallow breathing, the lungs are not given enough space in the chest cavity to expand sufficiently to bring in all the air we need. If we then increase the speed with which we breathe to compensate for this, it can cause the disorder known as hyperventilation. But this means that we will breathe out too much carbon dioxide, which in turn may cause imbalance in the acid-base balance of the blood. In order for the body to function optimally, the blood needs to be alkaline with a pH level of 7.4. It's extremely important for the metabolism that the blood has the correct acid-base balance, since this has a direct effect on the cell's ability to free and extract oxygen. Even small changes will cause great problems for the cells, and so the body has a special function that monitors and restricts any imbalance as soon as possible. When too much carbon dioxide disappears through the exhale and the level in the blood falls below a critical point, This triggers an inhibition of the stimuli to the respiratory center in the brain, which makes us stop breathing. In particular, when the hyperventilation disorder is caused by stress or general anxiety, the inability to breathe may lead to an immediate alarm to the body sympathetic system and cause what we would call a panic attack. If hyperventilation is allowed to continue over a longer period, the body will also adjust the acid-base balance to the lower carbon dioxide level. This may lead to a symptom known as alkalosis, which involves cramps and muscular spasms, leading to intense pain in both muscles and joints. Unfortunately, the hyperventilation syndrome is surrounded by confusion and misunderstanding. This is partly because the name hyperventilation stands for hyper, meaning too much, and ventilation, the flow or movement of air. But hyperventilation is far from breathing too much. Rather, it refers to insufficient breathing. A person with insufficient breathing can breathe extensively without bringing much oxygen into their body, whereas a person with a correct breathing pattern can breathe almost invisibly and still bring in more oxygen. What determines the difference is the quality of the breathing, not the amount of air itself. The confusion surrounding hyperventilation is reflected in the diagnosis and treatment of this problem. Some disorders, such as diabetes, can lower the pH value of the blood without changing the carbon dioxide level. Since the respiratory center can't distinguish this, it leads to a faster breathing pattern. Too little is still known about the effects of incorrect breathing, and it's still common for breathing disorders to remain undetected or to be incorrectly diagnosed as something that may lead to long-term medication or unnecessary medical treatment. For an otherwise healthy person, chronic hyperventilation will often lead to no more than a general lowering of bodily functions. But for a person with a heart condition, for example, hyperventilation can be life-threatening. It is also common to treat the patient with tranquilizers, since the breathing disorder is considered to be caused by psychological disorders that are considered best treated with this type of drug. To make the connection that breathing disorders can cause psychological disorders is still very rare. The symptoms of hyperventilation are principally increased adrenaline secretion, increased heart rate, and contracted muscles. Hyperventilation also increases the tendency for nose breathing, which leads to irritation on the membranes. In addition, the histamine level in the blood will increase, which leads to increased sweating in the hands and under the arms, and a deeper facial tone. These symptoms usually disappear as soon as the situation that triggered the hyperventilation is resolved. More serious symptoms of hyperventilation can be irregular heartbeat or chest pain, breathing difficulties, dry cough, dizziness, numbness in the fingers and toes, digestive disorders, often irritable bowel syndrome and gases, tiredness, sleep disorders, and also phobia, anxiety, and sexual disorders. It's common for people with chronic breathing disorders to mistake the symptoms for signs of more serious physical problems such as heart attacks, brain tumors, or cancer in the stomach. This in turn increases the anxiety that may initially cause the hyperventilation, and so the cycle feeds back on itself. Hyperventilation could also be the cause of a number of psychosomatic disorders such as allergies, anorexia, asthma, cancer, circulatory disorders, diabetes, epilepsy, colds, weakened immune systems, heart conditions, skin disorders, headache, migraine, hypertension caused by tightened muscles, menstruation disorders, rheumatism, back problems, and sexual disorders. Now, one way of avoiding the risk of hyperventilation is to exercise the diaphragm. Like any other muscle, it needs exercise to maintain its vigor and functionality. One exercise is to put an extra strain on the diaphragm to pump up the muscle. Lie on your back and place a 2-kilo bag of rice, sand, or similar flexible material between your chest and stomach. Breathe in as normal through the nose so that the weight on your stomach moves upward. Breathe out through the mouth so that the weight returns to normal. Repeat this for 5 to 10 minutes. Remove the weight and finish the exercise by breathing normally for a few minutes without the weight on the stomach. Repeat this exercise twice a day. It's estimated that around 10 to 15% of people in the Western world, children as well as adults, suffer from recurring hyperventilation. Some women are more likely to hyperventilate the week before or after their period, and in the last months of pregnancy. One reason is the increased level of progesterone that leads to an increase in the breathing rate. Some women hyperventilate when they give birth, which actually increases the pain and tightens the muscles, so slowing down and complicating the birth process. The most common way of preventing hyperventilation during labor is to teach the mother breathing and relaxation exercises that she can perform during birth. People with other breathing disorders, in particular asthma, are more likely to hyperventilate. People who suffer from hypertension, that also causes high blood pressure, are more likely to hyperventilate. This really is a vicious circle, since hyperventilation also causes this type of disorder. Many teenagers suffer from hyperventilation, often caused by high expectations from their family combined with poor self-esteem, poor diet and eating habits, and too little physical activity. Adults in similar circumstances suffer the same risk. A person who starts to hyperventilate as a consequence of experiencing strong emotions or acute stress will often seek medical advice in the fear of being seriously ill or even dying. When we can't understand what's happening or what's causing the strong bodily reaction, we often feel as if we're losing control. This can lead to intense anxiety and panic. The medical treatment often consists of preventing and controlling the symptoms. Most commonly, this is done with sedatives by injection of intravenous calcium and by getting the patient to breathe in the same air as they breathe out. To achieve this, the patient either breathes with a paper bag or the hands in front of and covering the mouth and nose. This helps to restore the acid-base balance in the blood. According to Fried, this treatment can be as dangerous to the patient as the hyperventilation itself. One reason is that it makes the patient dependent on external assistance instead of learning to come out of hyperventilation pattern unaided. When instead hyperventilating patients are guided through the attack and taught how to restore their normal breathing pattern, this has a positive effect. To show the patient that they can come out of the situation without assistance gives an increased sense of control, which both minimizes the anxiety and the risk with hyperventilation in the future. Since most of the Eastern breathing exercises are based on slow and deep breathing, they do not cause hyperventilation. Yet since some of the modern breathing techniques involve more intense breathing, they may cause hyperventilation. In fact, faster than normal breathing breathwork is often incorrectly described as a form of hyperventilation. This is because an incorrect breathing pattern during a session may lead to hyperventilation. But if this is not discovered and corrected, it may even cause cramps or alkalosis. Now, the risk of this type of hyperventilation is greatest when someone is just beginning to learn how to breathe faster and maintain an open and relaxed breathing pattern throughout the session. A good breathing instructor, however, will know how to avoid hyperventilation by precise instructions of how to increase the relaxation, shortening or lengthening the breaths, and how to vary the intensity in the breathing patterns. At the same time, however, the correct breathing pattern in breathwork is often confused with hyperventilation, since it to some extent can resemble real hyperventilation. To mark the difference, breathwork is sometimes described as superventilation. Unlike hyperventilation, which has a forced exhale, breathwork has a relaxed and effortless exhale. This means that the acid-base level remains unaffected. Regardless of the length and the intensity of the breathing pattern, breathwork correctly undertaken does not lead to hyperventilation. It may give a tingling sensation throughout the body, as if the blood has become carbonized or fizzy, but despite its intensity, it's usually perceived as positive, indeed quite pleasant sensation. It's often followed by a sense of deep relaxation throughout the body and can also lead to strong emotional experiences and important mental insights and revelations. In certain situations, superventilation can also lead to contractions of the muscles and even muscle spasms. The explanation for this is that the intensive breathing pattern dissolves too many of the psychophysical energy blockages at the same time, causing a state of temporary imbalance in the body's circulatory system. The intensified breathing patterns also increase the circulation in areas of the body that have suffered from some degree of restriction. It can be compared with the reaction when the circulation in an arm or leg has been restricted momentarily. When the flow is reopened, it leads to a tingling sensation until the flow has been rebalanced. Unlike hyperventilation, where it takes time to regain the acid-base level of the blood, the muscle spasms caused by superventilation can disappear instantly. This may coincide with a mental or emotional connection to a re-experienced memory. The spasms can disappear completely in a single breath and lead to intense vibrations and tinglings throughout the body. Now, over the years, correctly monitored, faster than normal breathing protocols have been used for healing and prevention of recidivism in physical conditions like the cancer research done in Poland, or the addictions recovery work done in Canada with alcoholism, and in Australia with depression and anxiety. The clinical usage of faster than normal breathing in a style called holotropic was effectively used in a community hospital setting in the United States for over 12 years with 11,000 patients. No complaints of adverse reactions were recorded during the sessions nor afterwards on any of the clinical units. I personally have used slower and faster than normal breathing techniques since the mid-1970s as a psychotherapist to assist the healing of childhood sexual abuse and trauma in clients of all ages who are unable to break through their walls of fear with traditional verbal therapies. A number of these individuals were so taken by their recovery, they went on to get professional degrees and become excellent body and breath-oriented therapists themselves. There are increasing numbers of professionally trained breath workers providing invaluable service in our world. Dispelling the myths about all faster than normal breathing causing hyperventilation is an important step in validating a technique that is a significant advance in our clinical repertoire and a life-transforming gift to countless numbers needing support that talking about their challenges from trauma to spiritual growth does not offer.